to the endorsement interview for District 33 House. My name is Aaron Mesh. I'm the managing editor. This is Nigel Jaquist, Lucas Manfield, and Sophie Peel.
Yeah.
We will be chatting with you for about half an hour today. The goal of this conversation is to figure out who we're going to endorse in this primary. So we're going to get to know the three of you rather rapidly, and also try to get some sense of what distinguishes you and where you differ from one another on some issues. Why don't we have each of you introduce yourselves with a roughly 1 minute introduction about who you are and why you're running for office. We'll start here.
My name is Pete Graviel. My core democratic values are a result of my unusual upbringing. I was the fifth of 8 children with a family of modest means. We grew up with 5 boys in one room. My father came here when he was 9, speaking only Spanish. My parents didn't have a college education when I was growing up, but they did go back to college in their late 30s and early 40s. And that left a powerful impression on all the kids that public education is the means of upward social mobility. All of us had to pitch in to make it work. I started working as a paperboy at the age of 8. I continued working all the way through college and put myself to the University of California, Berkeley. At times we didn't have health care. I understand how important health care, how sad it is when we'll have health care uncertainty. I'd like to see a universal public option be part of American life one day. When you don't have a lot of money, the only vacation you can afford is camping. We camped all over the western United States. I became a lifelong environmentalist. After Berkeley, I went to George Washington University Law School. I then went on to become a climate change negotiator at the United Nations, working with developing countries for 10 years. When I came to Portland, I returned to private life. I have an 8-year-old daughter. She was 1 when I arrived. I run the soccer league here at the Hillside Soccer Club with some friends.
Why'd you move to Portland?
I moved to Portland because I loved the values. I loved the access to nature. And I thought it was a great place to raise a family. And that's changed dramatically since I've arrived. The public safety situation on our streets, livability, how tough it's become for small businesses, for families to enjoy the parks. That's what's motivated me to run.
And what do you do for a living?
I'm a downtown business lawyer and trial lawyer.
Go ahead.
Yes. Hello, and thanks for having me. I'm Shannon Jones Isidore, born and raised right here in Portland. I grew up in the Albina district, where my family, where a community actually came together to send me to college. I'm the first in my family to attend college, and now I have a double master's in family psychotherapy and counseling science. I'm a proud United States Marine Corps veteran, and I have been, for over a decade, I've been an investment broker helping middle-income families to save and invest money. Today, I'm the CEO and founder of Oregon Change Clinic, where we help people who are struggling through substance use disorder, mental health challenges, and in need of supportive housing. I always lead with my values of high accountability, structure, and integrity. And today I run because some of Oregon's top issues are my life's work: addiction, supportive housing, and helping to bring businesses back to downtown.
Great, thank you.
Thanks. I'm Brian Duty, also born in Portland, Oregon, at Emmanuel. Grew up in Happy Valley, it sounds like the rest of the group. I was the first person in family to go to college, and had a mentor at that time who was going into nursing school and impressed upon me the value of public service, and so went to medical school and then at OHSU, and then did my residency there. Completed my training in New York, and then came back and have been in district since 2012. And the thing, after about 5 years of kind of being in practice, feeling more comfortable taking care of patients, what it became very clear, the factors that were really impacting the health and well-being of my patients had nothing to do with the stuff that we talk about at our faculty meetings or at conferences, like what treatment to do or what technique to use, what laser to use, or this or that, but it really was the social determinants of health. And so I became very passionate about healthcare advocacy at that point, and have gotten very involved, especially during the pandemic, in capacity management for OHSU. And so it was one of the first.
What's that mean?
So yeah, I was going to kind of explain. So during the pandemic, we had to make difficult decisions about what patients were operated on and which patients we had to delay, and I was involved in setting that process up. I work in an office called Mission Control as well, and we control the flow of patients across our healthcare system. We are constantly at capacity. If there is a patient who needs to be transferred to OHSU or a health system, it comes through us when we're on call to make decisions about who gets transferred and who doesn't. And then also been involved, on the state level, on the executive committee Committee of the OMA, and for the Health Evidence Review Commission, Vice Chair of the Value-Based Benefits Committee. That's the committee that makes decisions about what things are covered for the Oregon Health Plan. And so, as a result of all these experiences, what I've learned is, I still can't I can't take care of the patients that are in my clinic unless I try to tackle these upstream problems. And so for me, the state legislature, it seems to be the best way to do that. In addition, there are a variety of other factors that I think why we're all running that I want to be more involved in.
Did you take a position, or did OMA take a position on the bill, the Ben Bowman bill this session that would have limited private equities?
They supported it.
And
And I supported it.
Your feelings on it. Why? Tell us how you thought about that bill and why.
Yeah, I think so. I'm going to answer. The bill doesn't solve the fundamental problem. The fundamental problem is that small clinics and health systems can't survive because of the Medicare physician fee schedule. Every year I go back to DC and I meet with our legislators to advocate for reform of physician payments. That's why clinics are failing. And so either what they do is they sell to private equity or to other large groups like United Healthcare, Optum, which now employs 10% of physicians, or then they enter into a healthcare system. To me, my concern is I don't want healthcare dollars being funneled out of the state. I want them to stay in Oregon. So that's my concern with the Oregon Medical Group, the Corvallis Clinic, and these other organizations that are failing that are being purchased by Optum and then private equity groups. So I'm supportive of it. I think there are things that could be, obviously worked on upstream, but I support that bill.
Great. Shannon, could you tell us the first bill that you would introduce upon election to the legislature?
I would say, since we are in a housing emergency, which I believe that we are, then I would go with anything that is helping us to be able to site and build more recovery housing more efficiently and quickly.
Thank you. Brian?
Mm-hmm. I initially would not introduce any bill. I think to be successful as a legislature, you have to spend sufficient time to be able to make connections to allow you to be able to advance legislation. So I'd start by beginning to forge those relationships. In addition, we just passed a major housing package this last year. We need to see how that's working. We need to study the data and see how we can modify the steps that we've already taken to make sure they're effective, rather than just try to throw another bill in it. We've done a lot, or I should say, the legislature did a lot during the short session over the last couple of years to tackle this. We don't just need to throw something on top of it. We need to look at what's working, study the data, and then make decisions based upon that. That's what I would do.
Great. Pete?
I would revisit the climate bills that led to the Republican walkouts in 2019 and 2020. I know the governor's done a lot of great work on climate through executive action, but those gains are not as secure as a bill that passes the House, Senate, and gets the governor's signature. A new governor could quickly undo all of that. And then I think the public defender crisis needs to be addressed immediately, and that would require legislation.
Can you talk briefly about that? You did not get the Oregon trial lawyer endorsement, which was one of many, but it was a little surprising to me that you didn't get that. Why do you think that is?
Well, I have won some of the biggest plaintiffs' jury verdicts in the history of the state. I won a $61 million verdict last summer, so naturally the trial lawyers would be a good fit for me. When I went in, they want three things. They want no caps on wrongful death damages. They never want anybody to have immunity, no matter how difficult the job the state is asking them to do, and they want to be able to sue people whenever someone breaks any law whatsoever. I don't think litigation is the answer to all of society's problems. I told them as much. I'm in this to get votes and voters, not endorsements, so I was honest with them. I could have walked in there and said those three things and walked out with the endorsement, I believe.
Sorry, brain freeze slightly. Could each of you talk about what it is that you think you bring to this race that your opponent does not? What qualification or what specialty or what life experience you have that separates you from your opponents in this race? We'll start with you.
Well, I can't speak to the two people very well. I've just met them for the first time today, but I'll tell you why I think I'm a good choice. There are two things. One, many of the decisions that we've made recently have been based upon our progressive values, but they've not had a framework in place. Measure 110 being a prime example. We made this decision, but we didn't have a framework in place to be able to successfully execute it. I'm all about data. So you look at, I lead value analysis for OHSU. Those are the decisions that are made about what products and services we're going to choose to enlist in. I'm on the value-based, like I said, I'm vice chair of this value-based committee that looks at data, so I'm all data-driven. So my approach to making difficult decisions would be based upon trying to analyze the data to the best degree. Now, with that said, data doesn't do anything for you if you can't build connections and relationships. So the other role that I have, which is actually 60% of my FTE at OHSU, is a position called strategic outreach. So I'm one of 2 physicians that travels all across Oregon, meeting with healthcare leaders as a liaison for OHSU to broker relationships. That way patients can get high quality care in their community. That is a completely relationship-based position. And myself and Jimmy Heilman, who's the other person that were chosen, because frankly we're able to build those relationships. So I think having the unique combination of kind of emotional intelligence combined with the ability to really analyze data and be pragmatic about how we execute, not focusing just on outcomes or the end product, but how we get there, I think is what sets me well.
Great.
Yes, I would say I'm the only one here who has actually done what needs to be done. So as we are needing to address addiction, address housing, homelessness, I've turned 37 beds, I've developed a 37-bed unit last year alone. We're working on...
Where is that 37-bed unit?
37-bed unit. We took a dilapidated motel and we turned it into 37 beds for those who are in recovery.
Right, where is it?
It's located downtown Portland on 6th Avenue. We're working on, that's here in this district, yes. And then we're also working on another 50 right now this year. So when we talk about, I'm not talking about what I think I can do, I'm not talking about what I'm gonna do, I'm talking about what's actually has been done and what we know that we're capable of. I'll also be the only Black woman in the legislature, shall I win this. Addition to that, I'll be the only one that brings a perspective of being a treatment provider.
Pete.
Legislator has to draft laws. I think I'm the only one who's ever drafted legislation and done so at the national and international level. And we have some complex problems we got to tackle here in Oregon. Climate change is a very complex problem. I'm the only one who's gone to the United Nations, spent 9 years, worked with industry, with governments in developing countries and industrialized countries, with green groups, and crafted a legislation that got through in 2016, which is called the Kigali Amendment, which is still the law of the world.
Which endorsement, Shannon, are you most proud to have received?
Yes. First, I'm proud to have a broad coalition of endorsers from those that are current and former elected officials, as well as union and trade associations. But I would say the one that I'm probably most proud of is Representative Janelle Bynum, who when we met and we were at the Capitol, she looked at me and she said that we need your voice here in Salem and that you can do it. And I think what Janelle also being a Black female and business owner, I would say that has meant the most to me. I think the other part is, I think Janelle also recognizes that it's about getting things done, but me being a legislator also creates hope for so many people.
Pete.
Governor Barbara Roberts, she was the first female governor. I had taken a position, my wife works in DEI, gender equity in the workplace, a nonprofit based out of New York City. It's an important issue in our family. I wrote a piece to People. It got on gender equity in Oregon. It got to Barbara Roberts. She invited me down. My wife was out of town on a business trip, so I got to bring my 8-year-old daughter. And she got to meet Barbara, and we talked about the issues facing women in her time and facing women now. And she agreed to endorse me. And that was a really special experience and a part of this campaign.
If it's okay, I'm going to kind of try to squeeze into personal endorsement. Governor Kitzhaber, he's been a mentor to me over the last 6 or 7 years. I think he's obviously a tremendous leader in terms of health policy, and Oregon has been, as a result of his leadership along with Bruce Goldberg and other individuals, we've been incredibly successful at actually tackling social determinants, so that way we can prevent disease where it occurs as opposed to just treating the disease once the patient arrives in the emergency department. And then from organizational...
Can I just slow down? What evidence would you offer to say that we've been incredibly successful?
So, well, I guess what I would say is So through the CCO model, so we've been able to decrease now there's no way to actually decrease the rise in cost of healthcare expenditures, but we've been able to lower the curve down to, I think it was like 3.2% through the CCO model. So the anticipated rise in spending has gone down under that model.
What about the outcomes?
And the outcomes have not suffered either.
Okay.
Yeah. OHSU did a very nice review a couple of years ago looking at the impact of the CCO model, and they looked at both outcomes and cost data, and it showed that it did reduce the rise in expenditures and maintained quality improvements. And I'm happy if you want to provide you with that article. But in terms of organization, I'd say SEIU, to me, wealth inequality underpins all of the issues that we're talking about, with the exception of environmental, although that wealth inequality has an impact on those individuals in terms of climate change as well. And I think the middle class, unfortunately, has been hollowed out over the last 60 70 years. And so the SEIU and the other labor and the other unions that I've been fortunate to get endorsements from really believe in their cause, and they are champions for the people that really don't have a voice. So I feel very fortunate to have their support.
Great. Questions?
One of the things we like to do is give each of you a chance to ask an opponent a question. So there are three of you. It's tough. You got to figure out which opponent you want to ask a question. The purpose of this is to allow you to illustrate contrasts or differences between the three of you. So, Shannon, why don't I ask you to go first? Please make it a question your opponent can answer. But ask either of them, or you can pass.
Just because you asked the question that I would have asked of him. Yes. So let me think if I have a question for Duty. Duty, do you think that, it seems like you're a busy fella.
I think we all are.
Yeah, and I'm just wondering about how much time you would be able to really commit to this position.
Yeah, well, I think, actually I have two roles at OHSU. One is this outreach role, which is the majority of my FTE at OHSU, and I would divest myself of that. I would be a conflict of interest if I was a legislature and had that position. So I would simply return to being, and I would get rid of my work on the OMA and these other organizations. I also run state advocacy for the American Neurological Association. I'll get rid of all those. But at the end of the day, I also need to see patients. That's why I'm doing this, right? Is to see the things that are affecting my patient. So I need to see the patient walk through the door and take care of them as well. So I would return to being a part-time clinician and divest myself of the rest of those things. And so during the actual session, I would probably have clinic on Friday, and then out of session would have probably 2 days of clinic, or 1 day of clinic, 1 day of OR, and then 3 days of being a legislator. Thanks.
Brian, you want to ask one of your opponent's question?
Yeah, I was going to ask Pete, I just got a question. I know you mentioned it earlier, and I was wondering, obviously in 2019 and 20 were the walkouts around cap and trade, and I noticed you brought it up. I agree, it's something that's not very stable when you have an executive order, and we've seen that through law. So how would you, and it's nice as possible, how would you work to get it across the finish line and prevent, the last couple of times they weren't able to get it done?
I think we still have the majority, not the super majorities we have, but the big change is that the measure that prevents future walkouts. And so you can't just take your ball and leave. The Republicans, when they don't like what we're doing, they don't have the votes to stop it. So I think we should revisit it now that we have that law, that if you walk out this time to prevent a quorum, you're never coming back after this term. And I think that's coercive enough to get them to sit at the table and let's have a vote.
Pete, do you have a question for either of your opponents?
Yes, so I came out pretty early in support of reintroducing the criminal justice system in a treatment-focused way to manage our substance abuse disorder, and I have supported the bill that did that recently. Brian, what was your position on the bill, and when did you have that position first?
Just for people who are watching, we're talking about House Bill 4002, which was a partial reversal of Measure 110.
Yeah, it was a reform of Measure 110.
Yeah, I guess I would just say, Pete, like the two of you, I've lived here for a long time. I totally agree. What's happening to the people in the community that are suffering from substance abuse is not okay. What's happening to the rest of the community is not okay. And I think that's why most of us are compelled to run. And so clearly it's an issue. I think we've all been affected by it. I've been affected by it clinically, affected by it. So, I've had, multiple things, break-ins and things stolen, that sort of. But to answer your question, I was in favor of recriminalizing. So, however, the concern that I have, once again, is we know that doing so disproportionately affects the BIPOC population. We need to make sure we combat against that. And then also, our criminal justice system is not staffed well enough to be able to deal with it. At least that's my understanding, is that we do not have enough public defenders. So I am worried, though, about we have the same thing with 110. So we passed 110. We did not have the framework in place to be able to deal the capacity to be able to deal with substance use treatment. Now we've criminalized it, and we still don't have the system in place to be able to deal with it. We don't have enough public defenders, we don't have enough diversion or deflection programs, and so that's just my concern. Clearly we need to make a change. The bill's been passed, but we need to work on capacity. Day one, how do we build capacity to deal with that?
Can you each talk about a professional failure? Maybe your biggest professional failure?
Oh.
And not just that, maybe you were wronged by someone, like an instance where you feel like you personally failed, either in judgment, yeah.
And what you learned from it.
Sure.
I can go first, or
Go ahead.
well, as a surgeon, it's complications, and so when you have a major complication, which happens, it's devastating. It's not only like, it's visceral. Like, you lay on the ground nauseated and want to throw up when you have that kind of complication. Every surgeon has one, and you live with that, right? Or when you have a patient die because, once again, you couldn't get them to the operating room in time. What did I do about that? I literally had a patient get canceled because of COVID. We didn't have enough beds. They got rescheduled and they died waiting for surgery. And I had to call the family and tell them I'm so sorry, and I've known this family for over a decade. And so what did I do about it? So, if I have a complication, I do everything in my ability to try to learn from that, to improve my surgical skills, to make sure that doesn't happen. When my patients have adverse outcomes because of capacity, I got really involved. Like I said, got involved in mission control. That's the capacity management for OHSU. I got involved in strategic outreach to develop programs so patients can get care in their communities.
So sorry, just to interrupt, these don't sound like personal failure. This sounds like a failure of the system. Can you talk about a failure you had?
A complication is a failure. This is the ultimate failure. Someone entrusts their life in your hands, and you operate on them, and they have a major complication. That is a personal. You may have felt like you did everything right, but I tell you, it is impossible not to have that affect you.
Mm-hmm. Mm-hmm. All right, thank you.
Do you want to go next?
I can.
So I know that my campaign work on HFCs, which is the greenhouse gas that we've now removed to eliminate from the world at the United Nations. It took 9 years, which for people in the UN seems pretty quick, but for me it seemed like a long time. And I think the first couple years I saw every opponent of what exactly I wanted to do as an enemy, and rather than an ally in waiting. That's someone I just needed to get to understand their motivations, empower or potentially empower them to be effective, and that they would be along for the journey. And I think that the first 2 or 3 years I butted a lot of heads with other governments that didn't agree with me, when in reality I should have been more on a listening and modest education tour versus going out. And I think I learned from that, grew up a lot as an advocate, and helped me later. But for a couple years there, it was very frustrating.
Yeah.
Well,
Sure.
Yes. As I was thinking, because there's challenges all the time, and you just kind of pivot and you learn from it. But as I'm thinking, I would say that I started out as a psychologist and in the behavioral health world, and then I made a pivot and was in the investment world and was helping and educating middle-income families on how to save and invest money. And although it was going well, I would say that I would have probably left that sooner and returned to behavioral health a lot sooner. So.
There are people, Shannon, who call the organization that you worked for a multi-level marketing scheme. Is that accurate?
Are we talking World Financial?
Yeah.
And I don't think that's accurate at all.
No.
Yeah. I worked as an independent investment advisor, and what we were actually doing is I had multiple relationships with different insurance and investment organizations, and then I could sit down with families and find out exactly what their needs were, and then help them to make choices on the best investments for them.
So it was
And then
independent, you weren't getting compensated for bringing other people into the organization?
No, you don't get compensation like that.
Well, I think we are pretty much out of time, unfortunately, as much as I'd like to keep going. So we have one fun question that we do at the end of each of these, and that is, if there was a movie made of your life, who would you like as an actor to play you? We'll start.
Ewan McGregor's character in Big Fish.
So we'll take Ewan McGregor. We're looking for the actor.
I would say, and I'm not sure if you know her, her name is Gabrielle Union.
Of course.
Oh, okay, yes.
I have no idea. Tobey Maguire. I've been told that I look like him.
There you go.
So, thank you all for coming in. We're going to do photographs afterwards, so we have a decent photo to use. If you go out this door, there'll be a photographer waiting for you out there. You don't have to wear a clown nose or anything like that.
Okay.
Just going to get a good shot. Thanks for coming in.
All right,
Thanks.
thank you.
Thank you.